Competency-based education. Teacher is known not by his aura, but by his aim. A key feature for a teacher is to decide what the student should learn. What the student should learn can be specified as learning outcomes, competencies, and professional methods, activities. In outcome competency-based education, there is a switch of emphasis from the education process to the product and what the students will achieve. Decisions about the curriculum, teaching and learning methods, and assessment are informed by the expected learning outcome and competencies. Outcome competency-based education OPE, CPE require that learning outcomes, competencies expected at the end of training and at the end of each phase of training are clearly stated, expected and communicated to all concerned, including teachers, students, and other stakeholders such as employer in the health service. Decision about curriculum, including contents, the educational strategies, the teaching methods, and assessments are based on the agreed learning outcome competencies. There is collectively endorsed vision that reflects a commitment that students will succeed. The learner's achievement of the exit outcomes before they leave the program of training is more important than the time spent in the program. Offers major advantages. First, highlights the competencies achieved by the learner. Second, it's necessary given the rapid advances in medicine. Also, it ensures consideration is given to important topics that otherwise might be neglected, emphasizing accountability and transparency in medical education. Empowers students and points them in the right direction. Also provides the basis for the allocation and resources to providers. Ensures that the assessment is more valid in that way. Provides continuity across the continuum of medical education. Also, it flags up problems in the curriculum. If there are any problems, it will appear in that way. Helps teacher to select the appropriate topics to be taught in a teaching session. Facilitate mobility of doctors and enable curricula in different countries to be compared. Now specifying the learning outcomes and competencies. OPE and the specification of learning outcomes are now features of training programs for many specialties in medicine, with the learning outcomes or competencies agreed by the relevant postgraduate training body or authority. In the United States, the ACGME, and in Canada, the Royal College and the surgeon have led the field. Medical school can build on a national statement of learning outcomes with an expanded version reflecting the particular mission of the school. A community-oriented medical school or a school with the aim of qualifying future researchers or leaders in medicine will reflect this orientation in its statement of learning outcomes. Each institution, teachers are responsible for specifying the learning outcomes for each course and for each lecture or clinical training session within the course. These outcome statements identify how each specific learning experience contributes to the exit learning outcome for the school's educational program. Now, what about the involvement of stakeholders? The specification of learning outcomes is a key step in the education process, and the range of stakeholders should be involved. This may include specialties in the field, practicing doctors in hospitals and in the community, university teachers and education students and recent graduates also involved. Other professions like nurses, representatives of employers, patients, and representative of patient groups, the public also involved in that can be used to specify the expected learning outcomes include focus group discussions and nominal group technique, the Delphi technique, critical incident survey, studies of error in practice, task analysis, interview with recent graduates, a study of existing curricula and publications. A learning outcome framework should meet the following criteria. The key domains identified should reflect the vision and mission of the institution as perceived by various stakeholders, including the public. Also, the domains should be defined as an appropriate level of generality, and the number of domains should be small enough to be manageable, but large enough to distinguish different aspects of competence. Framework should provide a holistic and integrated view of medical practice and indicate the relationship between the different outcome domains. The framework should assist with the development of enabling outcomes for each of the key domains specified. The framework should be clear and ambiguous. It should be intuitive and easy to use. An outcome-based approach in practice. Outcome-based education requires two things. First, it requires the learning outcomes need to be identified and specified. Secondly, decisions about the curriculum must be based on the specific outcomes. Outcome-based education involves more than simply defining and publishing a set of learning outcomes that must be achieved before the end of the course. OPE is characterized by a curriculum where the learning strategies and learning opportunities are designed to ensure that students achieve the learning outcomes specified and where the assessment process matches the learning outcomes. Recognition of the importance of OBE implementation in practice is challenging. of course, and the teachers have not found it easy to incorporate OBE into their curriculum. Some principles, such as a move from a time-based model to an outcome-based model, are difficult to put into practice. Some learning outcomes, such as professionals, and are more difficult to incorporate into the curriculum. The professionalism is very difficult, of course. Implementation guidelines. The guidelines for implementation are the introduction of a competencies-based approach in a time-based system, while difficult is possible. Secondly, ensure that staff are familiar with and receptive to the introduction of an outcome-based approach. Third, ensure that the culture of the institution reflects the move to an outcome-based approach. Fourth, prepare a curriculum map that includes the learning outcomes. Also pay particular attention to outcomes that are more difficult to address, such as professionalism, and encourage a scholarly approach. Thank you.